2024 marks significant sporting events like the Olympics and the World T20, making it an opportune moment to discuss the importance of speed while maintaining efficiency and accuracy. A champion sportsman excels in combining those skills. While drawing parallels between sports and eye surgeries may seem unconventional, there are notable similarities. In surgery, there can be no compromise on safety, efficiency, and precision. Those who aspire to improve their skills will see actual progress. Those who prioritize speed have a chance to excel. We have compiled tips and techniques to reduce surgical time without compromising outcomes. Just as a child progresses from crawling to walking with natural coordination and speed, in surgical procedures too, it becomes intuitive as one gains proficiency in joint movements and spatial awareness. Novice surgeons take longer to complete surgical steps compared to experts. Factors like maneuver familiarity, hand-eye coordination, and the fear of complications contribute to slower performance. Practice, particularly on simulators and in wet labs, can significantly enhance a surgeon's speed. Performing the same step absolutely identically again and again trains muscle memory, enabling faster decision-making in surgical procedures. Engagement during observation is crucial. Observing through the surgical microscope's viewing arm enhances visibility of finer details in high magnification and stereoscopic view. A prospective observational study conducted at the VST Center for Glaucoma Care (LVPEI) from December 2020 to April 2021 identified various factors affecting the duration of phacoemulsification steps. These factors were analyzed and compared between experts, fellows, and residents with fewer than 50 surgeries. Key findings from the surgery include: while differences in total surgery time and individual steps like capsulorrhexis and phacoemulsification were expected between groups, it unexpectedly highlighted substantial disparities in periods of inactivity and instrument exchanges. Novice surgeons spend time observing the eye, contemplating next steps, instructing nurses, and adjusting microscopes. Visualization techniques, where surgeons mentally rehearse procedures in detail, are effective for preparation for normal surgeries and managing complications. Familiarity with equipment such as microscopes and phaco machines will allow hands-free rapid focusing and using appropriate settings, reducing procedural pauses. Strategic planning before surgery can also streamline procedures. For instance, deciding on instrument modification beforehand can eliminate time-consuming on-table decisions. For example, in this case of young patient with traumatic cataract and 2 to 3 clock hours of zonular dialysis, keeping the capsulorrhexis forceps ready while operating saved time, as will keeping a list of items in case of a posterior capsular rent while operating on a posterior polar cataract. Optimal utilization of technology and materials can significantly enhance efficiency and safety. A good microscope is a surgeon's best friend. And even if you don't have one, technology such as Omniglow can bring you close by significantly enhancing retroillumination. So, bye-bye to staining. Use of software such as Callisto for intraoperative axis alignment in case of toric IOL also saves time. There are different ways of performing a surgical step correctly, and making the right choice can save you time. For example, using a single keratome for triplanar clear corneal incision in phacoemulsification over using 3 separate instruments for the same incision. Using cohesive viscoelastic for IOL implantation will make the viscoaspiration quicker, as cohesives are easy to aspirate completely. And finally, once you have gained consistency and confidence, some safe shortcuts can help you save time. While performing hydrodissection, using the cannula or a spatula to separate the anterior capsule and the cortex will loosen the cortical fibers from the capsule. making cortical wash easy and fast. If a surgeon is sure about the hydrodissection and sees a proper wave beneath the nucleus, dialing the nucleus can be skipped. While not performing hydrodelineation may be considered risky, an experienced surgeon can remove the nucleus as well as epinucleus at the same go. Implanting an intraocular lens under irrigation eliminates the need of a viscoelastic. Some intraocular lenses may be more suitable, and this should be avoided when the cornea is compromised or if the anterior chamber is fluctuating. We all have seen beginners struggling to achieve a watertight closure of the paracentesis and the wound. Anterior stromal hydration is an easier and faster way of closing the incisional wounds. Using an irrigation aspiration port or a single port aspiration with an anterior chamber maintainer eliminates the need of a viscoelastic, and in cataracts with liquefied cortex can really save you time while performing rexes compared to the traditional technique where repeated injections of viscoelastic may be required. We all know that forceful irrigation of the posterior capsule at the end of the surgery leaves clear, shiny posterior capsule. However, if this step is performed before irrigation aspiration, it can loosen the cortex and reduce the time required for cortical wash. While the glamour of performing a surgery fast is very enticing, at no point of time does the surgeon compromise patient safety. A surgeon should keep an eye and an open mind towards increasing the speed of their surgery, especially as a beginner, when a lot of time is wasted if attention is not paid to learning the right skills. Wish you a happy, safe, and a fast operating career.